Hello friends. In this video we will be discussing about top 10 facts about abortion. Number 1. Abortion is the termination of a pregnancy before the fetus can survive outside of the womb. Number 2. The legality of abortion varies by country, with some countries having strict laws and others having more liberal laws. In some countries, such as Canada and the United Kingdom, abortion is legal and widely available, with few restrictions. In these countries, women have the right to access safe and legal abortion services and can make their own decisions about their reproductive health. In other countries, such as Ireland and Poland, abortion is heavily restricted, and in some cases, it is illegal altogether except in certain circumstances such as when the life of the mother is in danger. In these countries, women may be required to obtain parental consent, undergo mandatory counseling, or wait a certain period of time before obtaining an abortion. Number 3. The most common method of abortion is vacuum aspiration, which is usually performed during the first trimester of pregnancy. It is a safe and simple procedure that can be performed in a clinic or hospital setting. During the procedure, the cervix is dilated, and a hollow plastic tube with a vacuum suction is inserted into the uterus. The suction created by the vacuum pulls the contents of the uterus out through the tube. The procedure is usually done under local anesthesia, and it takes about 5 to 10 minutes to complete. Vacuum aspiration is usually performed during the first 12 weeks of pregnancy, although it can be done up to 16 weeks in some cases. The most common side effects include cramping, bleeding, and some light spotting. One of the benefits of vacuum aspiration is that it is a very effective method of abortion, with a success rate of over 98%. Women are usually able to return to their normal activities within a day or two of the procedure. Number 4. The World Health Organization estimates that 25 million unsafe abortions occur annually, mostly in developing countries. Unsafe abortions can lead to serious complications such as infection, bleeding, and even death. According to the WHO, unsafe abortion is one of the leading causes of maternal mortality worldwide, accounting for approximately 13% of maternal deaths. In fact, it is estimated that every 8 minutes, a woman dies from complications related to unsafe abortion. The majority of unsafe abortions occur in countries where abortion is heavily restricted or illegal, and where access to safe and legal abortion services is limited. Number 5. The Supreme Court of the United States established a woman's legal right to have an abortion in the 1973 case Roe v. Wade. Number 6. Some of the reasons why women choose to have abortions include not being able to afford a child, not being ready for parenthood, and health concerns for the mother or fetus. Number 7. There are two main types of abortion: medical and surgical. Medical abortion is a method of ending a pregnancy using medication. The most common medication used for medical abortion is mifepristone, in combination with misoprostol. Mifepristone is taken orally and blocks the hormone progesterone, which is necessary for a pregnancy to continue. Misoprostol is then taken 24 to 48 hours later and causes the uterus to contract and expel the pregnancy. Medical abortion can be done up to 10 weeks of pregnancy. It is considered to be a safe and effective method of abortion, with a success rate of over 95%. Surgical abortion, on the other hand, is a procedure that physically removes the pregnancy from the uterus. The most common method of surgical abortion is vacuum aspiration, which is usually performed during the first trimester of pregnancy. Surgical abortion can also be done by a procedure called dilation and evacuation, DNE, which is performed in the second trimester of pregnancy. Medical abortion has become more common as it is more accessible, less invasive, and it doesn't need to be done in a surgical setting. A woman can have a medical abortion at home or at a clinic, and the recovery time is usually shorter than with surgical abortion. Both types of abortion have their own benefits and drawbacks, and it's important to discuss with a healthcare provider to determine which method is the best option for a particular woman's situation. Number 8. Some people who are against abortion also advocate for adoption as an alternative. They believe that every child has a right to life and that adoption is a viable option for women who are not able or willing to raise a child. They argue that adoption provides a loving and stable home for children who would otherwise be aborted, and that it also provides an opportunity for infertile couples or individuals to have a family. Number 9. Some people who oppose abortion do so on religious or moral grounds, while others believe that it is equivalent to murder. Number 10, abortion can have physical and emotional side effects, and it is important for women to seek counseling and support before and after the procedure.